Hey, it's Elena here at Channel 4. Hope that you're doing really well. All right, on the line we have Dr. Rayan Damaj, consultant paediatrician at Reem Hospital, Abu Dhabi.
Hi, Elena.
Dr. Rayan, how are you today?
I'm good, thanks very much.
Good. Well, thank you so much for your time today. A topic that's very important, obesity within children. What is childhood obesity exactly?
So that's actually a very important question. Childhood obesity is on the rise and it's a killer. Currently, 1 in 5 children are overweight and approximately 1 in 10 are obese. The numbers, sadly, in the UAE are higher. So if you talk about childhood obesity, extra fat that your child is having. The AAP guidelines define it as a BMI score of more than 85 according to age. So it's not similar to the calculations to the adult BMI.
And what health problems can it lead to exactly?
So when we think about health problems, we actually divide them into 3. So we think about short-term health problems, long-term health problems, and then the most important, the psychosocial health problems. Okay. So the short-term health problems are, for example, it's going to be I'm going to try not to use too much jargon, but so high blood pressure, insulin resistance, high lipid, fatty liver, sleep apnea. Long-term outcome could be adult obesity, stroke, heart problems. And then when we think about the psychosocial impact, it's really low self-esteem and it really affects the child.
So it's really, really concerning and an issue that is to be avoided at all costs. What can parents or guardians do to prevent obesity within their children or child?
So we think there's a huge misconception thinking that a child is obese because he eats too much. But actually it's multifactorial. It's a whole lifestyle and we wouldn't recommend a child to be on a diet. So really looking into changing the whole lifestyle of the family even. Mm-hmm. So general recommendations is we want to decrease our intake, increase our activity, and then working upon each point. So for example, decreasing our intake, less sugary food, less processed food, and not bringing them into the household. It's the whole lifestyle change. We don't really recommend looking at the numbers, so not the scale. Keep on positive reinforcements like we're going to have a healthy lifestyle. We're not really looking at numbers or looking at shapes and sizes. We wouldn't want to judge that. And then in terms of activity, so mostly no screen time below 2, and that's a common one these days. Like most children come in and they're watching TV, eating, so they'll know when they're full or not. Less than 2 hours of screen time for children older than 2, and then making sure they get no good amount of sleep. So sleep is associated with also obesity. And then not skipping meals. Family meals actually helps with decreasing the risk of obesity. So it's a multifactorial thing. It has to be incorporated into the family as a lifestyle change.
You know, it's such an important issue, isn't it? And something that unfortunately is a little tricky to talk about sometimes, but it's such an important conversation to be having. So Dr. Rayan, I really, really appreciate your time today and all your advice as well. Thank you so much.
It is an important issue, which I hope we can tackle as a population.
Of course. Dr. Rayan from Reem Hospital, Abu Dhabi, thank you so much again for your time. Enjoy the rest of your day. Take care.
Take care, you too.
Thank you. Bye.